Welcome. Our topic today is suicide prevention and postvention, the employer role. The workplace is the last crucible of sustained human contact for the now almost 50,000 people who kill themselves each year in the United States. A coworker's suicide has a deep, disturbing impact on workmates. For managers, such tragedies pose challenges no one ever covered in management school. This was a quote from the Wall Street Journal from a number of years ago, and it's even still true today. Hi, I'm Sally Spencer Thomas. I'm a psychologist by training, and I lost my brother to suicide in 2004. And that has put me on a pathway to be very passionate about workplace suicide prevention. I'm currently the president of United Suicide Survivors International, and I co-chair the Workplace Prevention and Postvention Committee with Dr. Jody Jacobson Fry.
Hi, everyone. I'm Jody Fry. I'm a professor at the University of Maryland, Baltimore School of Social Work. I've been working to study suicide prevention and broader adult behavioral health in the workplace for over 20 years. And I co-chair the committee that Sally mentioned with the American Association of Suicidology.
Hi, everyone. I'm Maggie Mortale. I'm a senior program director for the American Foundation for Suicide Prevention. And in my role, I work with institutions of higher education, organizations, and workplaces to build out comprehensive suicide prevention programming.
Today, we're going to be highlighting the national guidelines for workplace suicide prevention. And this effort is a collaborative partnership between the American Association of Suicidology, the American Foundation for Suicide Prevention, and United Suicide Survivors International, three of the leading thought leaders and nonprofits in suicide prevention in the United States.
So our objectives are listed here, and overall, we hope that participants will be able to better understand suicide prevention as a workplace health and safety priority and take action steps towards building a sustained and really comprehensive strategy for workplace suicide prevention. In the United States, suicide data are reported by the Centers of Disease Control and Prevention, or CDC. And in 2018, the most recent year for which data are available, over 48,000 suicide deaths occurred in 2018. And among the working population, ages 16 to 64 years of age, suicide is the fourth leading cause of death, with over 38,000 suicide deaths occurring in that age group. And we've seen over time an increase in suicide rates among both groups between 1999 and 2018, with the suicide rates increasing 35% in the general population and increasing 41% in the working age population. In a 2020 report from CDC looking at suicide rates for major industries and occupational groups, the researchers identified major occupational groups, which are listed here, the top 5 major occupational groups with higher rates of suicide than the overall population. So the important takeaway from this data are that they provide insight into some of the differences in suicide rates within these occupational groups and will help to inform strategies to prevent suicide in workplace settings.
So I think it's important to understand that work is a social structure and that it also does relate directly to suicide risk. When work is working well for people, the workplace can provide meaning and reasons for living through the fostering of social relationships, through offering people a place of purpose and solidarity, and setting a social structure. However, when work is not working well, it can really lead to disintegration in the workplace, and the individual employees suffer. Workers are sometimes only seen as a source of profit or an obstacle to that profit. And Emil Durkheim considered suicide as a society-determined phenomena in which the role of work was essential in playing a significant role. Perhaps more recently, employers have become increasingly aware of a need and a benefit for addressing not only mental health promotion in the workplace, but suicide-specific prevention from both a business cost perspective and a social responsibility perspective. When we set out to develop the U.S. national guidelines for workplace suicide prevention, The vision was to imagine a world where workplaces make suicide prevention a health and safety priority. And ultimately, this world would be one in which no one dies in isolation and despair. So the guiding strategy and mission of the guidelines is to engage employers and professional associations to become leaders in addressing suicide prevention in a comprehensive way. And we needed to provide them with a roadmap so that those organizations that were ready to jump in and take the first step would have resources and tools to help them bake in suicide prevention into all aspects of the workplace. We needed to do this in a way that engaged stakeholders from the very beginning so that they were telling us what strengths they had, what gaps there were, and that they would be champions of future workplace programs. And in order to collect this data, we used multiple methods, including 13 focus groups, in-depth interviews, and a national survey. We made sure that we included stakeholders from mental health, provider groups such as employee assistance and human resources, and reached out to industries such as construction and first responders where suicide rates are higher. We also made sure to include representatives from employment law, workplace violence, safety, wellness, and peer support that you'll hear about later. And perhaps most importantly, we made sure that we had employees in the workplace that also could share lived experience through experiencing the suicide death or attempt of a loved one or coworker while employed. What did we find? We found that a number of work organizations were in fact ready to embark on making suicide prevention a health and safety priority. And these were some of their leading motivations. You can see all of them listed here, but the top two were first, increasing employee health and well-being. And second, we were really pleased that almost 3/4 felt it was the right thing to do. However, if everybody was ready to do this and there was just motivation, there'd be no need for the national guidelines. So we did recognize and collect data to identify what are the barriers to making suicide prevention a health and safety priority. And the top leading response was getting leadership buy-in, which has become a critical part of our guiding roadmap for employers and professional organizations to start this process. Followed very closely by resource lack of funding and lack of time.
So this also resulted, all of this data helped make us cognizant of the need for some guiding principles. And these are the 8 that we developed to help decision making. First, the work needs to be strategic. It can't just be a one-off training or a one-off awareness day. It really needs to be baked into other health and safety priorities. And it needs to be a slow drip over time, a comprehensive and sustained investment of both human resources and financial resources. We also felt strongly that it wasn't good enough just to get quote unquote troubled workers to help. Workplaces also needed to look at their own environmental psychosocial hazards, things like poor work design or bullying, hazing, harassment, discrimination, things in the environment that were driving people to despair, whether or not they had a mental health condition. We also felt very strongly that it was important to have this be a culture mindset, a mindset of caring, of looking out for one another, and that when we needed to have people show up in with dignity and respect when others were experiencing their darkest days. It also wasn't good enough to people just being pulled back from the brink of despair. We also needed to focus on how we could promote a life worth living. When it comes to the resources, it wasn't good enough just to have a whole bunch of lists of links on your website. People need to have a deep understanding of these resources. So when there was that warm handoff, people had a high sense of credibility and trust in the resources. And finally, having an awareness day or 2 won't do the trick. We need to move feet and take action with policies and skill building. We also knew that it was important to frame this work in what we call the upstream, midstream, and downstream approaches. Many of you in public health would be familiar with this parable of the stream. And we know that if we're only focused on the downstream, which is where suicide prevention usually lands, we're just metaphorically rescuing people from drowning in the river. And yes, we might be able to save some people that way, but we're going to miss a whole bunch. And everybody gets exhausted and overwhelmed if that's our only approach. So we also need to look upstream, what's putting people in the water to begin with, and are there some midstream approaches, things that we can help in the midstream before things become catastrophic. And this framework led us to unveil 9 different practices. And as you see here, this is what they look like when you get to the website, workplacesuicideprevention.com. We have them organized by upstream approaches, things that promote protective factors, midstream approaches, how do we help identify things early and link people to a buffet of resources, and then downstream approaches. What's our plan when people are in crisis? And my colleagues will help identify these proposed solutions.
So upstream strategies build protective factors that can mitigate risk. This can include creating a sense of belonging, eliminating stigmatized language and discriminating actions, building resilience through life skills and mental robustness or hardiness, and enhancing overall mental health literacy and suicide prevention literacy. There are many opportunities for upstream suicide prevention strategies listed here. And really, leadership sets the tone for building this culture of trust and community resilience for all employees and all employees within the workplace and the workplace culture. Part of the upstream approach is to assess and address any job strain or toxic work contributors, which I'll talk about in a moment, and then communicating this information about the value of employee well-being and support, recognizing and rewarding employee resilience. All of these are upstream approaches that can be integrated into workplace suicide prevention strategies. So job strain and suicide are linked. Toxic work demands, along with negative employee perceptions of the work environment and the work culture, have been historically left out or omitted from suicide prevention conversations. However, research connects a number of job stress-related behaviors or factors rather, that are all listed here, and to suicide risk, to suicide attempts, and to suicide deaths.
In the midstream, again, we're looking to identify problems as they're emerging. We all know with all of our health problems, the earlier we catch it, the better the prognosis is. Same thing here. And so our midstream approaches are helping, first of all, helping people be empowered to do this on their own, identify their own mental health and suicide risk problems through screening tools. But we also want to train the community, really empower them to be knowledgeable and confident in identifying when people might be struggling, but also how to approach them with compassion. So we also have training programs that we recommend, as well as building out a more formal peer support program that might look like an ambassador or an ombudsman or a peer buddy, but some kind of mid-tier approach to helping people get to the right resources. When it comes to stratified training, it's helpful to think of this along the lines of a CPR model, right? We all know how that works. Everybody gets CPR training. They get it multiple times, knowing full well that when it comes to the moment, people may or may not be able to engage in those skills. What we do know is that the more we train and the more people we train, the greater the likelihood that somebody's going to raise their hand and say, I've got this, and they're going to do the thing that needs to be done to save someone's life. Same idea with suicide prevention stratified training. At the base level, we can train different people in evidence-based suicide prevention trainings like QPR or Working Minds. And then we have an increased likelihood that somebody's going to be able to engage in those effective conversations. But it becomes stratified because we also know, just like the CPR model, we need a mid-tier of advanced trained people. So that would be an EMT on the CPR model. On the suicide prevention model, it's that advanced peer network that has a little bit more skills, knowledge, and empathy to do the right thing when it comes to a suicide risk. And then at the top of our pyramid, we want to make sure that those professionals, those highly trained people that we're bringing people to, know what they're doing when we bring people who are experiencing suicide risk to them, and that our mental health providers are adequately trained in state-of-the-art suicide risk assessment and management.
And that brings us right into our downstream solutions. So as much as we promote upstream policy and culture change and mid-level training and risk recognition, we need to make sure that our response system is ready and capable to both assess risk and respond to risk over time. So it's important as part of a national comprehensive strategy that we look at our mental health and crisis resources. Are they accessible? Are they high quality? Are we promoting them in our workplace in a way that positions them for success, whether it be an employee assistance program or a community mental health program that's working in partnership with a workplace? We also need to think about a response plan. We know that even with a focus on suicide prevention, that suicide crises do take place. And therefore, it's important to have what we call a postvention plan. One example that's available on the workplacesuicideprevention.com website is this manager's guide to postvention. This was created several years ago and it has been used by many HR and other workplace leaderships throughout the country and the world. And they find it to be very helpful in the sense that it provides 10 action steps for how workplaces can provide an immediate trauma response to a suicide crisis in the workplace, focus on what are the short-term recovery steps, and also think strategically about long-term processes and procedures and steps to help employees cope down the line. So I would encourage everyone to take a look at this resource that's freely available as a guide on how to develop a framework and policy and actually respond to suicide attempt or death in the workplace. So we wanted to make sure today, as part of our objectives, that you had something to take away. So here we are presenting at the Work and Family Research Network, and it's exciting to look at the current research coming out that connects work-life integration, work-life conflict with more macro levels of leadership, communication, and policy change as it relates to suicide. So we really feel that this is an important group for us to be speaking to today, as we encourage you to join us in the workplace in being part of the solution in making suicide prevention a health and safety priority. It's very easy to go to www.workplacesuicideprevention.com and take the pledge today as a work organization, professional organization, or even as an individual stakeholder. We launched October 10th, 2019, World Mental Health Day, and already we have over 630 pledge partners. We've received many media mentions that you may have seen about the national guidelines, and I think the time is really ripe where employers are recognizing, again, from the motivational slide that we provided earlier, that they're ready to embark in a journey to make suicide prevention a priority, particularly within a broader health and well-being framework. And they also are recognizing that it's the right thing to do. So we've created this roadmap online and provided you with an overview today. And we encourage you to join us, and you'll earn badges for becoming suicide informed, because who doesn't like to be recognized for their hard work? So we've made a really simple program online where workplaces that take the pledge can earn a bronze pledge partner, and then have a ready-made toolkit online of how they can work towards becoming a more suicide-informed, comprehensive suicide prevention program in their workplace. We also feel that it's important to continue the learning, as more and more research is coming out every day on suicide prevention, and there are some education and resource training available online, particularly both for mental health professionals as you're thinking about who your referral resources are, but also for lay folk and for other stakeholders in the workplace like a QPR or Safe Talk or Working Minds. We also recommend taking a look at some of the new new screening programs that are coming out every day for the workplace. One of them is the interactive screening program through AFSP, to use technology as a way to reach out to employees that perhaps have not considered or aren't ready to pick up the phone to call for help. And of course, the postvention guide that we mentioned. So in conclusion, we encourage all of you to be vocal, be visible, and be visionary. There is no shame in stepping forward, but there is great risk in holding back and just hoping for the best. Thank you for giving us this opportunity to introduce you to the national guidelines on workplace suicide prevention. We hope you'll stay connected with us. We have multiple ways that you can connect through Facebook, Twitter, Instagram, and of course our website. And all of our contact information is here. We'd be happy to talk with you about how we can work in partnership to continue this call for action towards more research, connection with work life, macro practice, organizational change, and ultimately suicide prevention. Thank you.